Ah, choo! Hey everybody, it's Chef Tiffany Benson here, and some of y'all are sneezy, eyes are running, your face is itchy. Hello, your nose are running, your stuff, you're itchy. It's disturbing your life, right? You on a drug right now. You on that Zyrtec, you on that Claritin, you on that Allegra. You're taking the steroid shot because you just can't, right? So today, we're going to be talking about allergies. We're going to be talking about natural remedies for allergies and a way to keep some money in your pocket, real talk, because this allergy medication industry is a multi-billion-dollar industry. Okay. So, I mean, Zyrtec is like not cheap. It's like $1 each. Right? I mean, here in the States, it's like around there, if not more, the last time I checked. So, lock in. I'm going to teach you guys how to cleanse your noses, okay? How to keep that nose clean, how to make sure that those symptoms like the sneezing, the runny nose, the itchy, I've been there, okay? You're just like, that's how I feel, right? I'm sorry if I hit my mic with my hands. I get passionate sometimes, but yeah, we gonna talk about it today, okay? So over here, I have my presentation. So if you see me looking over here, that's because that's what's here. So we're gonna talk about allergies today. We're gonna talk about specifically more like seasonal allergies. I'm gonna touch on a little bit of like asthma because it's kind of like, you know, just a touch with the salt therapy situation, okay? So, we're going to talk about understanding seasonal allergies. We're going to take an in-depth look at it through way of salt, okay? Cuz that's what we're doing today. So, how many of y'all have allergies? Okay. So what exactly are allergies, right? So usually pollen, mold, dust. These are like the primary allergens that trigger the seasonal allergy symptoms, right? Leads to a lot of discomfort, annoyance. I mean, it's a valid health concern. Like every year around this time of pollination, right? We going through it. So usually what you're prescribed is an antihistamine or a nasal spray, right? And these are usually good enough. I'm sorry about my dog barking in the background. So utilizing antihistamines, nasal sprays can really, really help us. And usually what we want to do is like avoid the triggers, right? And those triggers could be like being outside. But that's not fair. I want to go outside, especially during this time of year. It's so nice. It's so pretty. It's springtime, new life is emerging. The animals are, doing their thing, So, of all times of the year, this is the time where you want to be outside, right? Here in Florida, this is like that time. It's cool, it's not too hot. So, I've definitely been enjoying this time, all right? But drop where you are in the comment section. Let me know where you guys are at and what kind of symptoms you guys are experiencing as far as your state, okay? So, like we said, seasonal allergies cause discomfort, okay? Scientific name, allergic rhinitis, short AR. Sometimes you'll see it like that. This affects your social life, right? Your sleep, your school, your work, making this treatment imperative, right? So, did you know that 40% of people have seasonal allergies? 40%. That's a huge group, right? And up to 13% have perennial allergies. So, I think I kind of touched on this earlier, but medical spending to treat this has doubled. And these are old numbers that I'm pulling from the National Library of Medicine. Y'all know that's my site. That's where I be. So if you're ever wondering where my sourcing is, it's from the National Library of Medicine. This is a study they did it in 2000, the year 2000. Medical spending doubled from 6.1 billion in 2000, the year 2000, to 11.2 billion in 2005. Okay, and that's 20 years ago. So who, like, Google it, drop it in the comment section. How many billions of dollars per year are we spending on allergy meds? So that means that in 2005, out-of-pocket expenses related to allergies were $520 per person. Okay, that's a lot, you know? So, according to the National Library of Medicine, management of allergic rhinitis encompasses patient education. That was the first thing. Ta-da! Here I am, providing education, and or avoidance of the allergens, as well as using, allergen-specific medicines that you can take, right? The administration of steroids is effective, but because of a fear around cortisone treatments, not only in patients, but even in doctors, a lot of doctors don't like to give cortisone shots. So, yeah, most people just go to the pharmacy, right, and get some Zyrtec or Allegra or whatever the case may be, and that's just what we do, right? Well, you have options. There's other options that you can take if you'd like to. So the first thing I want to talk about, and which I'm actually going to demonstrate here in a little bit, is a saline nasal irrigation process using a neti pot. Okay, we're using an isotonic rinsing solution, and we do this because that has a neutral pH and it's the healthiest way of salting the nose with a neutral pH. So we have the salts, we have the distilled water, and the neti pot actually right now is cooling for this demonstration that I'm going to do in a little bit. I love y'all so much that I'm going to nasal flush here live on video camera. Okay, so real quick, okay, the people that should not use a neti pot are people who have any kind of injuries to the anterior part of your nose. Okay, maybe you were an athlete or a boxer, or you've gotten hit in the nose, cheerleaders, people who have a lot of nose injuries, be careful. Okay, as well as people who have maybe any kind of nasal irritation that causes consistent bleeding. Just if you have nasal problems or any kind of nasal issues, please don't use a neti pot, and always consult with your physician before taking any kind of, treatments. Okay. All right. So what the neti pot does is it flushes out thick mucus, crusts, also known as boogers, debris, allergens, and air pollutants. Okay. It also provides an anti-inflammatory process to the lining of your nose. Okay, which provides for better mucociliary clearance of your nose. So, one other thing I want to say. Today, you're going to see me use a traditional neti pot, okay? Which I put in my nose and tilt to the side and flush the water out. But in today's day and age, like what I'm using is like ancient, okay? And I I would have loved to go into more of that ancient history, but I want to get to the meat in this presentation. But what I'm using is the ancient Indian, not Native American, like India, right? The Indian traditional neti pot, okay? But they also sell devices for like swishing, like pushing up into your nose. They sell machines that do it. They sell all kinds of devices. I prefer like the ancient, more simple way of doing it. Um, and so that's what you're going to see today. Okay. However, also on top of that, even though, I'm more of like a purist, it has been scientifically proven that using these newer devices and actually pushing the salts, the saline solution up into your nose does provide a better process, but it's not necessary. And another thing about those like mechanical devices is that there's so many parts and so many pieces to clean that that makes me more like anxious about it, like I don't want to have to worry about cleaning, 10 different little pieces to make sure that they're all sanitized properly. Like, no, like I have one neti pot, you know what I mean? And it has one little nose piece that I don't even really have to use, but I do because it just makes the process easier, less to clean, less to manage, less to keep up with. Okay. So, another salt therapy treatment that I really love and enjoy, and this may be more accessible to you as far as like it being more convenient, but it's not gonna, this is, I would say, in today's day and age, more of a luxury service, and that is like going to like a salt room. And that's called halotherapy treatment, which is like a chamber that they create like an artificial salt mine, right? And you make an appointment and you sit inside of this room and you're just like breathing in salt. Now, this specifically is for my asthmatic people out there in the building. Okay, now I know this is not about asthma, this is more about allergies, but I just want to talk about y'all real quick because I love y'all and I feel for y'all. If you have really bad asthma, you know what I mean too, or more of like an inflammatory process that's happening to you during your allergies or in your sinuses, that type of salt therapy is really effective for you. Okay, bronchial asthma, chronic bronchitis, and chronic obstructive, like, just anything lung, okay? This helps big time in the anti-inflammatory process, okay? Including anti-allergic mechanisms. So that is powerful, okay? That there's also data that's been acquired to indicate a decrease in the body's sensitivities in the infectious and inflammatory process with people that have bronchial asthma after halotherapy treatment. Okay, so powerful research, powerful science there about salt and its ability to cleanse your respiratory system. Okay, so there are businesses like the Salt Room that provide that service where you can, I think it's like 30 minutes and you just sit in there and it's actually really relaxing. They have like salt lamps in there. However, if you're a woman like me who has like dreadlocks or braids or like sensitive to like things being in your hair, I definitely recommend you bringing your cap or your bonnet, your do-rag, because or at least the ones that I've been to, it's like they blow salt into the room as well. Like it's not only like salt all around you, like as far as like the walls, right, and the floor, like it's a salt room, literally, right? But they also have like an HVAC system that is blowing salt into the room. So it's like a it's like a salt storm. So you want to cover your hair, ladies. Heard, okay? Cover your hair. You got an afro, if you got braids, if you got dreadlocks, you know what I mean? Because a shake is not gonna do it. You're gonna have all this powder, like white powder, like stuck on your hair. But very effective. if that's in reach within your budget range, even though, this is more about, saving money and doing things that are a little bit more cost effective. If you have serious asthma or bronchitis or any kind of lung thing, salt is also for you. Okay. So let's get into the fun part, which is me actually showing you how to set up your neti pot, what kind of water that you need to use, the salt, the measurement. Okay, so lock in. I'll be right back with the flush. Hello, everybody. So I'm going to show you exactly how to use a neti pot today. So I have actually a ceramic neti pot that I really, really love. I got this off Amazon. I love the color. It kind of felt like a genie lamp to me, like I was gonna rub it and like Will Smith was gonna pop out. You know what I mean? um, so yeah, I got one of these and it has a rubber tip. This is really nice because, and I'm gonna put gloves on because what we're really gonna talk about today is safety and sanitation as far as this neti pot is concerned, because I've read that there have been some dangerous things happening. So I want to make sure that everyone understands and knows how to use this properly. Okay. So, as I was saying, here on the tip, you're not obligated to use a rubber tip. You could just use it like so. But I find like getting into the nostril is a lot easier with the tip. And it came with this. It also came with its own saline solution. But I like to use this one. It's neti salt, um, eco-friendly, pharmaceutical grade, refillable jar. There's 200 plus rinses in this. This is the original brand since 1972, Himalayan Chandra. And I hope I'm saying that right. You'll also notice, I want to show you, and or we've talked about the salt already, but this specific salt, and it's actually one of the things that they kind of advertise here on their packaging, is this specific one comes with a scoop inside that's pre-measured for a standard size neti pot, right? And if you look at it, I hope you can see there's a side that's bigger and then there's a side that's smaller. So depending on your personal nose and feeling, you can go lighter, you can go stronger. When you're starting out, I highly recommend that you go lighter with the salt. This is the perfect little portion right here. And then as you get further on in your neti journey, you could, use a little bit more salt if you'd like to. Okay? So that's really cool. I like that. And so there's several ways that you can do this, but I'm going to talk about the safest way to do this. Okay? So you want to make sure that you've cleaned your neti pot, you've cleaned and sanitized this. Because this is ceramic, I really love that you can get this hot, right? So you can put this in boiling, well, maybe not boiling, but I wouldn't put it in a pot with boiling water, just like bubbling around in there. But it's hot enough to put, or it's strong enough to put into like a bowl and pour the hot water over it when you first get it to like fully sanitize it. And you have to make sure that every time you're using this that you clean it. Okay. Wash it out real good. Take off the tip, get up underneath there. You know what I'm saying? Real simple. It doesn't have to take a whole lot of time, but just, rinse it, keep it somewhere that's away from any contaminants or pets or children. You can buy this in ceramic, you can buy it in plastic. But when you get the plastic, because of the factors that I've just described, you have to throw it away after X amount of uses. So if this is something that you're interested in doing, I just suggest that you just go ahead and invest and get you a nice ceramic neti pot that you love, that you think is really cute, because then you're more inclined to use it. All right. So next, let's talk about the water. So here I have some distilled water. This is what's recommended to be used. Distilled water, okay? Only distilled water. You never want to just go to your, sink and just put water into your neti pot and use it, because that water is not clean. The water needs to be cleaned. Distilled water is where you need to go. It's free of contaminants, right? But what I do, which is another method, is I pre-boil a filtered water. So the filtered water that I drink throughout the day, I will put into a kettle. So this is an electric kettle that I have here. I love to use an electric kettle because it just takes way less time. This is already like a thing, So you have to find ways to make this as quick as possible, right? So get you a kettle, electric kettle. Some of them have on here, it tells you the temperature. Okay, so water boils at 212 degrees Fahrenheit. Okay, so on here, it has different based on types of tea, which is really cool. And then it has a boil black, which means like for black teas or, coffee is what this is telling you. And it'll go to 212 degrees. We know that it's going to 212 degrees because there's bubbles in that water. You want the water to be at what chefs call a rolling boil. A rolling boil means that there's bubbles rolling there. Okay, they're moving around, they're doing their thing, they're dancing. We want a rolling boil. Okay, according to specifications for neti pot, 3 to 5 minutes of boil time for this water. Okay, so for this presentation, we're gonna, because I want you to see, we're gonna use distilled water and we're gonna boil it in the kettle, and then we're gonna put that water with salt into our neti solution, and then because this water is 212 degrees, it has to cool, right? So I'm gonna come back and then I'm gonna show you how to use this and rinse it. I'm gonna do it here with you live. I'm gonna neti pot rinse for you, okay? That's how much I love y'all. So listen, let's get started. So what I like to do is I like to just, before I even get to the water, I like to salt my neti pot. Because what I'm going to do, and which adds a level of sanitation to the pot itself, is I put that boiling water with the salt right into my neti pot as soon as it's done boiling. Okay. So like I said, I like to use the larger one because I like to feel the burn. I like to feel it. So you put that in there. Okay, if you have any questions about any of this, feel free to drop it in the comment section. So then I'm going to add my water to my pot here very carefully. And as you can see, this pot is not very big, so we don't need a lot. And good. Okay. We're going to boil and we're going to start. So this is going to boil the water for us very quickly and efficiently. Like I said, we're going to pour it right in here. I'm going to come back once it's cooled down, and I'm going to flush and show you what that actually looks like. Okay. So just to kind of talk you through the process right now, because when I come back, we're going to be ready. We're going to move right into the flush. Okay. So what you're doing is you are flushing the insides of your nostrils, right? So what that water is going to do is it's going to go in one side and it's going to flush out the other side. Okay, which is really awesome. So we're going to Just gonna take your neti pot, whatever style. There's all different kinds of styles of these. What you're gonna do is you're gonna put it in your nostril, like this. You're gonna tilt and pour that water through, like that. And you'll see in a little bit what that looks like. I do this twice a day during allergy season, in the morning and at night. In the morning, for whatever reason, I just feel like it just flushes me out from anything that I may have collected throughout the night while sleeping, from the sheets or from just like in the air. And at night, after my day of like being out or being outside, which I love to do, I'm constantly in like a pollinated area. Just flush all those irritants out of your nostril. Okay? So I'm going to bring the mic closer. I don't know if you guys can hear, but there's a rolling boil happening in here. There's bubbles bubbling in there. That's what you want. This machine is beeping. It's letting us know that it's ready. It's ready. I'll put this back on. And I'm going to let it continue to bubble. Right? We said at least 3 minutes is what you want. Okay. We've used the best quality water that we can for this, which would be a distilled water. Okay. And then we've boiled it to give it that extra bit of sanitation to make sure that this is a sanitary process. We've added our salt to our neti. We're going to pour our hot water right in here. Okay. Now, you don't want to fill it to the tippity tip because it's going to come out the front. Okay. And remember, this is boiling hot water. So especially when you set yourself up, and like another reason why I like to like salt it before, and I actually bring the water to the pot, not the neti pot to the kitchen, is because I just want to like eliminate any possibilities of spilling, of burning, of anything, right? So you want to bring the hot water to the bathroom and not your neti pot to the kitchen. And I hope that makes sense, okay? Also, my wearing of gloves right now is because I want you to understand that this needs to be a clean process. But usually I'm in my bathroom, right? Not out here filming, and I don't wear gloves, right? I just wash my hands before I do this, okay? So meet me back here in just a few once this cools off. Boiled distilled water that's in there. I already added salt to it. I have a bowl here because I'm going to lean over and flush right now. And then I have a towel just, because we're about to water. So what you want to do is, I love this one because it has the little rubber piece here that helps you like get it like suction on there, like so you're completely covered. But I'm going to show you. I'm going to start here. This is my right nostril, so I just put it in my nose like that. Okay. Ooh. All right, put it in your nose like that, and then you're going to lean. Okay. Very simple. It goes in, my right and comes out my left. So when I let go, you saw that some started to come out of both because it was still, flush from this side. Now you want to make sure to flush both sides. So you don't want to use all your water on one side, okay? So then you're going to come to the other side and you're going to do the same thing, okay? You're going to breathe out of your mouth, okay? You're breathing out of your mouth. All right, so it's empty now. And I come back
and let the water out of the other side. Okay? So like I mentioned, when you're doing that, you're not breathing out of your nose. You're not even using that system. You're just literally flushing it all out. As you can see, I didn't have, based on the consistency and how easily that flowed through, you can see that I do this often, right? I didn't have a lot of mucus in my sinuses, thankfully, today. It's been a pretty good day. So once I've flushed both sides, sometimes, like, depending on if I'm really stuffy or if I'm having a lot of symptoms, I'll go back. Like, I'll do one side, and then come back, other side, okay? And I'll just keep going until I feel relief. So what you'll find, and actually one of my favorite places to do this is in the shower, okay? Because you'll find that after you do this, your nose like just drips. Like the water is still like flushing, your nose is still flushing for about like maybe 15 to 20 minutes after you do this. So if you do this, this is not like something you do and then run out. If you do that, you need to make sure that you bring a tissue, a towel, some napkins, because your nose is going to run a little bit and then it's going to be fine. Okay, it's going to run for a little bit and then it'll be good. Now, you don't want to do this if you have like an ear infection, right? Or any kind of stuff going on that could prevent a problem with ears. This is not something you would do. So then after a little bit, after I'm done kind of like free dripping, I will blow my nose. And I will hold one side and gently, you're not going to come in here and, no, that's not what you're doing. You're going to gently, okay? Gently blow. And that's it. Now, this makes me feel, especially in the morning, when I do this, this is like a cup of coffee in the morning, really. And what I like to do to preset myself for my coffee in the morning, like this wakes me up. You know what I mean? Like you do a neti in the morning with a little salt run through your sinuses, you're like, hello, I'm awake, we're here. So anyways, to set myself up the night before, what I like to do is I boil the water, put the salt, set up the neti. I'll tent it over the top with like a paper towel or a towel just so that no irritants or pollutants get in there, and then it'll cool off. So then first thing in the morning, it's ready to go. And you don't have to like boil water in the morning and wait for it to cool down and etc. etc. For this presentation, for the full presentation, which you guys will see, you saw me boil water, fill this with salt, etc., etc. And then what I did to rush the process was I put it in the freezer, okay, just to like cool down the water a little bit more. You don't want to like put ice in here because ice is not, unless you've like boiled the water that you're gonna, create ice with, then if you put anything else in here, you're contaminating it, okay? So that's that. You saw me flush. Yeah, that's it. That was like so easy. You know what I mean? I know for a lot of people, like that's intimidating, but I hope that I just made it look very simple because it really is, and it's not hard. It's like not a drama. You just and then it's done, okay? And then this has really helped me. Like I don't have to buy allergy medication anymore, which is like for me a big deal. So I'm really, really grateful for this every morning, every night, till about like May, June. And then I don't have to do it like every day. Then I can do it like every once in a while, or if I know, like if I feel a little like, maybe a few times a week, depending on like my activity level, how much I'm outside, what kind of stuff's going on. Or if like I know that I'm dusting, or if I'm doing something that where I know that there's going to be pollutants in the air, I always make sure to bust out my neti after that. Okay? But I appreciate you guys watching. I'll see you guys next week. Bye.